Well, good evening. It's good to be here. Thank you guys for inviting me. It's a real honor to get to speak to a sort of a different audience than I normally talk to. So thank you.
Thank you, sir. Thank you. It's an honor for us to have you over.
Is there particular things you wanted to discuss?
Yes, sir.
Question-wise?
Yes,
Okay.
sir. For which I had already sent you the details on those questions. But they're basically with regards to your own lifestyle, your own carnivore diet, what got you into this lifestyle, and about Rivero is what I wanted to learn from you. So there are a couple of things that I have lined up in questions, and they're just very basic ones in terms of the carnivore diet.
Sure, sure. Well, I mean, if you want to ask, my own reasons for doing this were purely out of health. I mean, that's I think the major reason why we have to eat is to support our health and acquire nutrition. And as I had reached, sort of the midpoint of my life, I was probably in my mid 40s, and I wasn't where I wanted to be metabolically, health-wise, and so on and so forth. Despite being an athlete that was training extremely hard, the diet just wasn't supporting my health goals, and so I looked to various different ways of trying to fix that through nutrition. And so the initial thing I tried was what most people are told was I cut fat back very low. I ate a lot of vegetables. I ate lean sources of protein, and it worked in the sense that I was able to sort of get leaner and lose weight, but it was unsustainable for me. I found that to be I was pretty miserable, to be honest. And so after about 5 or 6, 7 years of experimenting with different diets, low carb diets, at some point I stumbled across a group of people just consuming a lot of meat, basically, and I thought that was quite strange, and as everybody does. But I was willing to try it, and once I tried it, I realized that I responded very well to that diet, and it's now coming on. I'll be starting my 8th year here next month, and so that's kind of an overview in that. And since that time, I've of course seen, gosh, I cannot tell you, thousands upon thousands of people have now adopted this kind of style of eating, and very commonly we see just a reversal of all sorts of health-related issues, whether it's diabetes, whether it's pre-diabetes, whether it's obesity, whether it's mental health issues, whether it's autoimmune issues, things like arthritis, skin diseases, things like that. We've seen tremendous success. And so obviously that's something as a physician I'm interested in, because that's the whole reason I exist, is to sort of try to help people with their health. And so that's kind of in a nutshell, so to speak, my introduction into this.
Nice. Beautiful, sir. Thank you so much. But yes, I would like to also put across my introduction to you, to the viewers who are watching us probably for the first time. And for me, you have always been a mentor. I have been very, very religiously advocating and proposing your diet, lifestyle that you've been teaching us all throughout Instagram and, of course, your Twitter now. So I'd really like to let the guest tonight, the viewers tonight, know what my guest actually does. So Dr. Shawn Baker, I believe you are an world champ athlete and orthopedic surgeon and the author of the bestseller, The Carnivore Diet. So I'd really like to bring the spotlight on to Dr. Shawn Baker tonight. Shawn, sir, you have been the carnivore king for about 7 years now. Am I right? And you, just as you said, you're going to be entering your 8th year advocating this and practicing it so religiously. Of course, I see all the kind of foods that you eat, and I try to replicate as much as I can living here in India. In India, we don't have access to cow meat, beef. The only thing we have access here is goat and buffalo meat, knowing that cow meat is creme de la creme. So can you tell us what is the most preferred meat in the United States?
I guess the question is, you said, what is the meat that we eat in the United States? Or
what is the most preferred meat, commonly preferred meat in the United States?
Well, in in the United States, chicken is the number one meat that is consumed, by the population numbers by far. Beef would be probably second, and then we have lamb, lamb, sheep, mutton, and then of course pork, and then seafood, of course. So by volume, chicken has surpassed beef, and it's done that since about the 1980s. And so I don't consume a lot of chicken. I prefer, and I know there's a lot of religious prohibitions around beef in India, of course, but uh, I think mutton, I think lamb is a wonderful. It's every bit as good as beef as far as health benefits. Now, some people have different taste preferences around that. Buffalo certainly would be acceptable. I think that for some reason, and I think there's maybe some evolutionary perspective on this, ruminant meat seems to be, an animal that ruminates, whether it's a sheep or a cow or a buffalo or a deer or something like that, seems to have a little bit of extra nutrition that is beneficial to us as humans. And I think if we go back to our evolutionary roots, we all were hunters at some point, and the most efficient things to hunt were big, large animals. If you think about, particularly with the technology that was available, it was mostly just close range spears and things like that. Range technology, the bow and arrow and different throwing devices weren't really prominent until about 80,000 years ago, at least based on the evolutionary records. And so prior to that, a lot of hunting was done close range, and if you can imagine trying to acquire a lot of food like chasing birds around with a spear is not going to be very efficient. And so I think we initially hunted large animals, butchered them, ate them, and that's part of how we kind of adapted as a species. So I think there's something to be said for that. It's not that, and I've seen some people that have successfully, done chicken, and because I know chicken is going to be obviously very available in India. To probably as one of the major sources. Of course, you've got the vegetarian population where eggs and dairy are quite prominent. So those are all, in my view, acceptable. Depending on compared to what else you have. Because I just heard your last guest talking. I caught the tail end of that, talking about metabolic health, and as you know, currently in India, I think something like 11% of the population is now diagnosed with diabetes. That's equal to what the United States rates are, which are horrible, by the way. And behind that is probably another 40% that are pre-diabetic. And so you see that it just wrecks the population health. And I think it's a problem with obviously the overall food selection, what's available. And I know there's a lot of people where, there may not be much choice. Sometimes your financial situation dictates what you can afford to eat. And you're kind of, in some ways you're stuck, but in other ways you do get to make choices on how you spend your capital.
Absolutely, I would agree to that, because many a times when we tell people to switch to these kind of lifestyle changes, the first question that they put out is, we can't afford it. So that's something I always tell them. You can always choose better foods over choosing medications. So if you look at it that way, these kind of foods are really not expensive.
Yeah, I can't, like I said, I can't speak to the cost of what chicken costs in India because unfortunately, I've never been there. Hopefully one day I'll get to visit at some point.
Sure you will.
There, I think one thing that is becoming more and more clear is the protein requirements are probably much higher than even the United States. Our RDA for protein is 0.8 grams per kilogram, which is, just barely enough to keep you alive. And my understanding is in India, a vast majority of the people don't even get that much. There's something like a significant percentage of the population doesn't even get the US RDA, which is already probably half of what it needs to be. I think the more reliable data, the more for thriving is closer to double that. So 1.6 grams per kilogram. And then if for some reason you want to be an athlete or put on more muscle, then even perhaps in some cases higher, depending on what else is in your diet.
What is the limit that you would go to in terms of protein? Is there like the RDA says 0.8, but is there something that you would say maybe like a 3 gram or even beyond that is fine?
Yeah, there was it's interesting. There was just a recent study that just came out looking at people that want to put on muscle and lose fat simultaneously, which is hard to do in many cases. Traditionally, when we're told when we want to put on muscle, we could be going a little bit of a caloric, increase, and And so we have to eat more protein, but we often put on fat. But to lose weight, lose body fat, and gain protein, there's studies out there supporting something like 2.5 grams per kilogram or up to 3 grams per kilogram, which is quite a bit of protein. And that's probably about what I consume, somewhere in that neighborhood. I weigh 250 pounds, which is about 120-ish kilos or so, 118 kilos, somewhere in that range. And I consume probably 300 grams of protein a day, something like that.
Wow, that's
I'm very active as well. So
yes, I do see that, of course, on all your videos that you have been doing a lot of resistance training and you're an athlete. So yes, absolutely, that requirement is justified. I totally agree with that. I would also love to know, Doctor, I came across this study in the Science Journal in which you conducted a study involving about 2029 adults who followed a carnivore diet for about a period of 6 months, if I'm not wrong. And I read this in the Science Direct Journal. It stated some very interesting numbers in terms of the improvement in their health. There were 100% diabetics that came off injectable medications, 92% going off insulin completely, and about 84% going off oral medication. This is commendable. I really want to hear your insights on this.
yeah, so that study, actually, I didn't conduct the study. I just helped to sort of facilitate it, I suppose. And David Ludwig at Harvard University was the senior author, and that Belinda Lennertz was the primary author. And they took 2,029 people that were following this sort of carnivore style of diet, and at minimum they were 6 months, and some people had been doing up to 28 years. So it was quite a long period of time. And yeah, in general, pretty much they generally all did very well, minimal side effects, but the diabetes data was quite compelling. And you're right that anybody that was on any kind of injectable medicines, things like SGLT2 inhibitors, GLP-1 receptor agonists, they came off those 100%. The type 2 diabetics, 92% of them were able to come off completely off of their insulin. And then even metformin, 84% were able to come off things like metformin or other oral meds, which is, there's very few interventions that have been that powerful, so it's just shows you how effective diet can be for some of these things. So a lot of people are told, hey, you've got diabetes, you're going to be on this pill for the rest of your life, particularly when it comes to insulin. And then they're constantly just injecting themselves, over consuming carbohydrates, injecting themselves, and it results in all kinds of complications, whether it's amputations, blindness, kidney failure, cardiovascular disease. That's another issue that, as you know, in India, there's a lot of cardiovascular disease now, which goes hand in hand. And I think if we think about, cancers, cardiovascular disease, mortality, all of it is funnels into what's going on with our metabolic health. And that is basically some form or fashion of diabetes, inflammation, gut health, which is also very important. All those things are sort of contributing to this.
Yes, absolutely. In fact, in India, this is one of the major issues when you're trying to get people off medications. That included my own mother, who's been diabetic for almost 30 plus years. And she's always been told to, only take medications over and over and not make a dietary lifestyle change. So this is one of the common issues, yes, we do face here. And only with the change in lifestyle, if people can understand, this can be, taken care of. I had another question with regards to your patients, as you are also a doctor, an orthopedic surgeon. What is your approach with your patients as it relates to these nutritional changes? Do you actually, explain to them the benefits of a carnivore diet, or then do you just take them step by step, further into it, or is it depending on individuals, case by case?
Yeah, I think that, while I'm a huge advocate of a carnivore diet, I think it can be wonderful for a number of conditions. It's not necessary for everybody. I mean, there's certainly people that can get better just by removing sort of the ultra processed foods out of their diet, sort of cutting back on perhaps some of the grains and refined carbohydrates. Those things are tremendously huge. Now you've got to replace them with something. And so I think in my experience, if we look at, how effective a diet is, number one, you have to do something that you like. You have to enjoy the food, and you have to also You also have to not be hungry all the time. If you're hungry all the time, you're never going to stick to any kind of dietary plan. So
You always
we
put
talk about that, and in many cases, they find various animal products to be quite a good. They provide quite a great sense of satiety, and this is where some of these new drugs that are out there. These you guys may have heard about them: the GLP-1 receptor agonists, the Ozempics, the semaglutides. They basically mimic in a way a lot of what consuming meat does, which provides the satiety and impacts these so-called incretin hormones in a very similar fashion. And so the problem with them is, it's if you continue to eat sugary grain-based foods and you take these drugs, you end up with some side effects which can be problematic and harmful in the long term. So I think particularly for people with autoimmune conditions, which are becoming increasingly prominent, like Crohn's disease and ulcerative colitis, the first thing I would do is go to a strict elimination diet. The gut is so impacted by our nutrition. I mean, we have physicians that don't seem to understand that, which is bizarre to me. I think for certainly food addiction, which a lot of people suffer from addiction to ultra processed food, particularly sugary ultra processed foods. It's very challenging to get off of that without sort of abstinence in many cases. And so it's like if you had somebody who was, struggling with alcoholism, you would not tell them just to, have a couple drinks a week. That wouldn't make sense and it wouldn't work, quite honestly. So I think there's certainly definitely people that will benefit from a very strict approach. But beyond that, what our company, like you mentioned, you alluded to, Rivera, we're licensed in all 50 states in the U.S. Hopefully, we'll have an international presence in a few years. But our approach is basically to move those major problem foods as a transition and then see what we need to do. Now, some people will have to go very strict and maybe go to a carnivore diet for a period of time. And that is something that, in my experience, has been quite effective at relieving a number of issues and sometimes resolving it completely. And then if they want to, they can sort to incorporate reintroduce other foods if they want to. Some people don't want to. Some people are so happy because it's such a simple dietary strategy. You think about it.
Less stress.
A lot of people spend a lot of time and it can be quite anxiety provoking thinking about food, planning food, preparing food, shopping for food, and then they eat their meal and they're immediately thinking about their next meal.
Yeah.
So with a carnivore style of diet, it's very simple. You're like, okay, well, how much sort of meat am I hungry for? Maybe some steak and eggs, and that's it. And it's not hard. It's not challenging at all. It's quite simple.
Yeah, that's amazing. So you probably would just go out, let's say, and you have your menu very set. Is that what it is? It's just steak and eggs. You really don't have to think about anything.
Yeah, my diet is very, quote unquote, boring. Some people would consider it boring, but yeah, I will have a steak for breakfast and probably one for dinner, and I might add a little bit of Greek yogurt or something, depending on what I'm trying to do with regard to, if I'm trying to get leaner or put on weight. It depends. And so that's most of, in the last, like I said, it'll be going on 8 years soon. I've probably consumed 97% of my calorie has just been through steak. I mean, that's not an exaggeration. And the other 3% has come from eggs, a little bit of dairy products like cheese, and then a few other, maybe some seafood, maybe a little bit of chicken and pork occasionally. And then very rarely, I mean, maybe a few times a year, I might have a little piece of fruit or even a piece of dessert. But it's my diet is almost exclusively, in my case, beef. And I know it's not available in India as for many people. But, if you look at the, again, population statistics, in the United States, we consume 100 kilograms of meat per year. And in India, it's something like 5 kilograms. And so even though many Indians consume meat, I think the majority are not vegetarians, but even still, that the amounts are so small. One of the smallest amounts in the whole world, I think, next to like Bangladesh. And you're seeing the results of that, I think, in the fact that you have such high, and it's what's being replaced with it. And we're seeing all this, like you said, you've got so much palm oil that has flooded you correct me if I'm wrong, but I think palm oil has largely supplanted things like ghee and butters and things like that.
Absolutely. We're clearing fats all the time in India, and we've replaced it with refined oils. And then, of course, we are looking at our lipid reports and we're blaming the fat for it. So that's one of the major issues that's really soaring here in India. lipid reports are high, our blood pressures are soaring, our HbA1cs, and yet people are just okay eating medications and trying to just suppress these symptoms and not take care of it, but they just don't want to make a dietary lifestyle change.
Yeah, I don't know if it's a systemic issue like it is in the United States, where it's probably easier just to give people medications than to actually change the food system, because that's challenging to do. Now, like I said, if this, I mean, individually you can make your own decisions, and that's what you have to sort of. I encourage people to do their own, to invest in their own health, because really no one is going to take care of you, so to speak, in a way that they should, and you have to take care of yourself, and you have to be invested in your own health. And I think at the very least, experiment with these different styles of life, because if you are sick and you're continuing eating the same way you've been eating over and over again, don't expect a different result, and you probably look around and see all the people, it's probably pretty predictable. You see people as they age, we expect them to get more arthritic and, hunched over and slowed down, and their ability to do anything,
yes,
their ability to do anything is quite low, and that's not how it has to be. I'm approaching, I'll be 60 soon, and wow, I can still run and jump and wrestle with 20-year-olds and all those things. And it largely has to do with, well, two things. One is I'm active and I train, but my diet allows me to do that. Adequate protein. I don't eat a lot of foods that otherwise would be inflammatory, which would cause me, the inability to do those things. And I think particularly if I had to point to it, I think grains and sugars are a huge driver of, as an orthopedic surgeon, orthopedic problems, arthritis, tendonitis, some of these neuropathies and things like that. We see, degenerative disease in the spine. These are all, in many cases, driven by diet.
Yeah. So that's what my question was, that being an orthopedic surgeon, incorporating this kind of a lifestyle has shown you results with your clients too. I'm sure it has.
Yeah, absolutely. This is something that, early on in my orthopedic career, people would come in. I remember people come in telling me that they felt that, eating bread would cause their knee pain, and I didn't believe them. I said that you're kind of crazy. I didn't believe that, because I wasn't trained about that. But now, in retrospect, these people, I think, were not only right, but it was more than that. It's a very a lot of people just think that, I twisted my knee 20 years ago and that's why I have a bad knee or something, or maybe I'm carrying a little bit too much weight. And, right, and that is an important point when you carry excess body fat. And I know in India, there's a lot of people that have these little pot bellies. Not really, yeah, we don't have the gigantic obesity like we have in the United States, but even that excess little body fat around the middle, if you're a male, is driving inflammatory problems. We have these inflammatory cytokines or adipokines that are coming from the fat tissue, and that makes your whole body achy, and it makes you not feel good. And so absolutely, diet impacts, I think a lot of even arthritis in particular, which is so common, is really just an orthopedic consequence of metabolic disease. And I think that it took me a lot of years to realize that. Mm-hmm. And not all, but in many cases, I've had patients where I literally had them signed up for surgery to replace their knee or replace their hip, and we changed their diet and their pain went away to the point they no longer required surgery. And that was, I thought, really that's when I had my first aha moment. This is about 10 years ago, when I was putting people on low-carb diets, and all of a sudden I was canceling surgeries. Now, that's something maybe a hospital doesn't like, because they depend on those surgeries to make money. Yes. But at the same time, I thought it was wonderful that we were able to avoid these major surgeries with diet changes.
Yeah, I think even a low-carb diet really helps to a great extent, and especially here in India, because 90% of our plates are on high carbs. So even if we come to low carb, if not carnivore, I'm sure we can make a difference here. Doctor, recently I read about you making a dietary shift to a ketogenic lifestyle. I would want to know the reasons behind this change and the lessons that you have gained from this, if that could help us too.
Yeah, well, I mean, as I mentioned, I'm active, and I was wrestling with some much younger kids than I was, and I ended up unfortunately injuring my neck. And so I have something called cervical radiculopathy. So one of the nerve roots was being impinged upon. So it was causing quite a bit of pain going down my right arm and numbness, a little bit of weakness. And so my diet, while carnivore, was not necessarily ketogenic because I tend to favor a little bit higher protein approach. And I eat a lot. I don't do a lot of fasting typically because I'm trying to maintain muscle mass. And so there is quite a decent amount of literature that shows that a more ketogenic style of diet is particularly helpful with neuroinflammatory conditions. And so this is a perfect condition for, I think, a higher percentage or sort of a more of a ketogenic type of style. And so I just shifted the protein down slightly and increased the fat up a little bit, and then consumed a little bit less food. And that has helped, reasonably well. I mean, it's not the only thing I'm doing. I'm doing some rehab therapy and things like that. Exercise is actually quite helpful. Regular exercise helps just in most conditions. But that was the reason for the shift. I'll probably maintain that probably for a little while longer. And then I'll probably go back to a little bit more protein because I like I said, I personally feel that lean mass is important for a number of reasons. And we know it protects us from cancer, heart disease, dementia, diabetes, all these things. And plus it makes you functionally more competent. And so quality of life is better. And so that is my sort of strategy for aging is to hang on that. The lean muscle you have is it's literally metabolic gold, if you want to think about it that way. Having lean mass and replacing sort of like excess body fat with lean mass was one of the most effective health interventions you can make across the board for just about any sort of outcome you're concerned about, whether it's mortality, like I said, cardiovascular disease, cancer, diabetes, on and on.
Lovely. Also, doctor, in terms of HbA1cs and putting diabetes to remission, would you recommend a carnivore diet? Because again, I read about your own HbA1cs coming to 5.2, one of your tweets that you mentioned, and eating 112 pounds of meat a week. Well, the reason I asked you this is because meat has been so demonized in India and so widely demonized in India that we've started relating every problem with meat. Meat causes cancer, meat inflames the gut, meat rots in your gut, and all sorts of things. So there is a lot of unlearning that we really need to do here in this country. And this is why I when I was reading your tweet that you mentioned, your HbA1c has come to 5.2 in spite of consuming that much of red meat. These are the significant challenges that we are facing. If we can get some insights on this and how we can address this.
Yeah, well, I mean, I want to. It's interesting. You mentioned, people thinking meat is inflammatory. Well, I mean, they're just literally within the last 2 days, Baylor University, which is in Texas in the United States, just published a research paper looking at red meat consumption specifically in inflammatory markers, and they found that there was no evidence that it caused any inflammation, and the only time it does is in the setting of obesity. And so it's really the obesity that's driving the inflammation. So if you do a meat-based diet, whether it's carnivore or close to carnivore, with if it's with lamb, chicken, buffalo, whatever you want to do, and you reliably are losing body fat, your inflammation is going down. And that's usually what I see. And so I think in the context of, yes, if you are consuming a junk food diet, refined processed carbohydrates and meat at the same time, then it's still whatever's causing the weight gain. It's not the meat. And typically, if you put somebody on a pure carnivore diet, they're going to get leaner. I mean, that almost invariably happens for almost everyone. There's few exceptions to that. And so with regard to diabetes, exactly the same thing. What I see consistently is that, and this is the thing, we've got so much bad nutrition science out there. Most of the nutrition science is this so-called epidemiologic studies, these associational studies where they're not testing people on a meat-based diet. They're testing people that eat a lot of junk food and then saying, well, it must be the meat. And it's clearly, that's not the way you want to test something. You don't, if you wanted to test the effects of of a drug, you wouldn't give them 30 other drugs at the same time and say, well, there's no way to figure that out. And so what we do have, the unique insight that a carnivore diet has given us, is the unique effects of meat. And when we do that, their diabetes goes away, their blood pressure normalizes, their body fat gets better, their inflammation goes down, and they feel better across the board. So meat is clearly not driving a major driver of disease. Now, the only exception to that would be is if you could somehow consume it in excess to where you gained a lot of body fat, but that usually doesn't occur. It's usually what's accompanying that. It's the refined grain products, the sugars, the oils and things like that are often utilized. So, but meat itself, you think about it, humans would have never evolved if meat was killing us. We would have never made it as a species. I mean, we relied on that as long as humans have been around. And I don't know what the perspective is in India about human evolution. I know from my perspective, Homo sapiens have been around about 300,000 years. And prior to that, we've had the different other Homo lineages, Homo erectus, Homo habilis, going back to almost 3 million years. And those records indicate meat was a huge part of our development as a species. And so had meat been something that was bad for us, we would have died off. Like, it's kind of interesting. We do have some primates that sort of tried to progress things like Australopithecus robustus and boisei, which were vegetarian or vegan actually, and they died. They couldn't make it in, and they could not make it in the world, and so they died off and they went extinct.
Yeah, vegan diets, the most common all around that you see. What is your advice or your say to those who follow a vegan diet? I do see a lot of your TikToks and I do see a lot of your memes that happen on Instagram, but I really want to know, what is your advice to somebody getting on this vegan bandwagon?
Well, I think, again, I don't think it is the most efficient or effective diet for health. And if you do it for, if you have some ethical belief, which unfortunately, I think those are a little misguided, but irrespective of that, if that's what you're going to do, then please focus on getting adequate protein. And I think you're going to have to eat a little bit more protein than someone on say a meat-based diet to get the same level of quality. It's very challenging. Most vegans will have issues with B12, certainly. Even sometimes supplementation may not be effective. There are a lot of other things in meat that are beneficial: carnitine, carnosine, creatine, anserine, taurine that you're not going to be consuming, choline that you're not going to be consuming on a plant-based diet. And so you're going to have to maybe supplement those things in addition if you want to have your best chances. And again, if your diet is 20% food and 80% supplements, maybe it's a problem. I'm sort of exaggerating a little bit there, but certainly please do strength training. Please increase your protein intake to a very adequate level, because that is a real challenge. And I don't know, I think in India it's probably even more so because I don't know how much access you have to some of the more, I guess, refined protein products that are sometimes available here.
Protein is really a major issue in India because, like I said, we fear protein, we fear fats, we fear protein because we feel that kidneys are going to be damaged, and we fear fats because we feel we're going to increase our lipids. So these are a couple of the major issues that we are fighting as yet here today. And yes, we're trying to do it, maybe not, trying to put everybody on a carnivore diet, but trying it with low carb and then trying to explain to them the benefits of how these diets can help. So I think we're kind of, US and India is probably sailing around the same boat.
Yeah, I think the point about protein harming the kidneys is something that should be addressed, and I think that's a misconception. It goes back to probably the 1980s, the so-called Brenner hypothesis, where Dr. Brenner was doing experiments on rats, and he found that rats on a high protein diet did develop glomerular damage, kidney damage. However, they've looked at that pretty extensively. Stu Phillips, really wonderful paper in, I think, 2018, 2019, large meta-analysis looking at higher protein diets and kidney damage. And so really there's no good human data that shows that. Now, when a kidney is failing, yes, it will spill protein, but it's not the protein that's causing the damage. It is, again, the diabetic pathophysiology in most cases, and so, and I actually see people with chronic kidney disease that go on a carnivore diet or a low-carb, higher protein diet, and they reduce the inflammatory grains and sugars, and their diabetes gets better, and their kidneys actually recover. They reverse their kidney disease in many cases. And so protein is not damaging the kidneys. So that is a problem. Now, a lot of times the way we measure kidney function, the most common way is often something called a serum creatinine. And that is, it's kind of what we've done for a long time. But in the context of a higher protein diet, creatinine can merely mean you have more muscle mass, or you're consuming more protein, or you're exercising very hard. And so in those situations, if creatinine is elevated, it may not be a problem. There's a better test called cystatin C, and I don't know how widely it is available in India, but that will give you a better estimate of your kidney function. I often tell people that they'll see their glomerular filtration rate go down, their serum creatinine go up, and they'll be told that they have kidney disease. And we say, no, do the correct tests. And they almost invariably come back with, no, it's actually normal. So I think and many physicians need to be trained on that. They're not aware of how to actually accurately assess renal function in someone on a higher protein diet. It's not that the creatinine is necessarily a problem in that situation. So it's a matter of education. And when your physicians don't know, the population doesn't know.
Absolutely right. Yeah, this is one of the fears that we need to keep, teaching people of and trying to convince them and counsel them on the protein really doesn't cause high uric acid. And that's another problem, high uric acid. Everything that they talk in terms of kidney is related to protein, even if it's uric acid. So the moment they see uric acid elevated, they will stop the protein. And this has been a problem because this information comes to the general public from the white coats. So then that becomes a little, problematic in terms of we trying to explain to them the other way. And they said, no, you don't know anything.
Well, let me just, and I don't know how much reverence the general population has for physicians in India, maybe quite a bit, but I will tell you, physicians get it wrong a lot of times. As a physician, I know we've been wrong many times, and people have been harmed for that. So I think if what they're telling you doesn't match your own personal experience, you might want to just sort of reconsider if the physician, because physicians are wrong very often. I think that's something that people need to understand that. And I like I said, I will say the only thing I know with 100% is I'm wrong about something, and I think that's just, I think that's a fair statement. We can't know it all, and we're often wrong. But what I will say is that you have to be your own advocate. I mean, don't just take, if something is not working for you, don't be afraid to say, hey, look, this is not working well for me, and I need to make a change. Because the physician, they don't have as much invested in you as you do. They don't have as much so-called skin in the game. You've got to take health into your own hands in many cases.
Yeah, that's so true. Doctor, what position would you place meat on a dietary pyramid? Would you say that it has all the essential nutrients for human survival and optimal health?
Yeah, I would say that, actually. I think you can live a long, successful, healthy, functional life on a purely meat-based diet. We've known that for many hundreds of years. In fact, this goes back to the times of when they were exploring the polar continents, and it came into people where that was basically their life. Free of disease, functioning, doing well, life expectancy just as good as what was known at the time. Now, of course, they're living in very hospital times. They had high infant mortality rates. They had a lot of violence and things like that they had to deal with. But they were living just as long as anyone else, and so you can do that. I think that it should make up the majority of nutrition, and I think everything else is just, maybe I like to call it flavor enhancement. If you want to have the vegetables and things like that, or fruits or spices, can be just to make it more interesting, if that's what you desire. I know India is a culture where spices and seasonings are very prominent. You've got I've had plenty of Indian food over the years. I know it can be quite delicious, but I think if you shift the focus to the meat and off the carbohydrates, the grains, it's going to provide tremendous benefit for your health and your quality of life.
Yeah, I would agree to that, because last 3 years since I made a shift to the carnivore diet, it has been completely meat based. But yes, living in an Indian household, I've had parents, I've had family who eat the way I eat also. But then I've had to incorporate a bit of spices, and I've had to incorporate a bit of Indian cultural spices, so that we get that taste and that palatability for foods. So yes, I have been doing it, but there's been absolutely no grains, no sugars. No beverages, no sugary beverages. So it has been a meat-based diet, but keeping in conjunction with the addition of spices. So that's the only thing I have been doing it for the last 3 years, and it's been very, very beneficial in terms of everything, in terms of inflammation, in terms of gut health, in terms of sleep. There's a big shift I noticed even when going carnivore. Sleep got so much better, it's got so much peaceful.
Yeah, I think that there are, as I mentioned, there are many reasons to do this diet. And I think for most people, having some spices is probably fine. There are some people where those things could be problematic for their gut. And in those cases, they just have to avoid that. But I think, yes, you can certainly do a meat-based diet and use the various spices that you enjoy. And you just have to be objective and say, how are they actually treating me? How am I feeling? What's my gut function doing? Do I have any inflammation associated with that? Because some people will have issues with that, but I think many people will tolerate it just fine. And again, it makes it more, again, we're talking sustainability. You want to do something that you enjoy. And if the prospect of eating a plain unspiced piece of meat sounds awful to you, then that's not going to work for you. So you have to be able to work it in a way that's enjoyable to you.
In your taste buds also. Absolutely. What is your take on fruits and vegetables? Because this is one of the topics that's really so sensitive. In India, the moment you tell somebody to get the fruits out, oh, I'm going to be missing the minerals and the vitamins, and all of that starts. So I want to know your views on that.
Well, yeah. So, the reason that we sort of revere fruits and vegetables is, because we think they have these, and they do, they have these sort of quote unquote phytonutrients, which have sort of maybe anti-inflammatory properties and antioxidant properties. But what we don't realize is that actually ruminant animals, grazing animals, actually have those very same compounds in their body to a degree. And in fact, they have a more varied diet than vegetative diet than we eat. They can consume plants that we cannot consume. And so they actually have extra phytonutrients within their fats, within their tissues, in various concentrations. And so you get all that through animal products anyway. There's a great paper from a guy named Stefan van Vliet when he was at Duke University, and they looked at this and they found that meat itself, he was looking at beef in this case, but you can extrapolate to goat, mutton, lamb, whatever, it doesn't matter. They have something like 50 to 70,000 individual nutritional compounds with them, including many of these phytonutrients. And so are fruits and vegetables bad or dangerous for you? I don't necessarily say that, but I think some people are sensitive to that. I think diabetics, particularly if they're consuming a lot of fruit, is going to have an impact on their hemoglobin A1C and blood glucose. And we know that running high blood glucoses for long periods of time undoubtedly causes complications, whether it be kidney disease, blindness, leading to the awful, amputations, which I've done, unfortunately, many of those through my career. So I think that, again, this is another one of those things that you have to objectively assess your own personal tolerance to these types of things. Some people can eat vegetables and they're fine. Other people, it causes a lot of gut issues. It causes a lot of distension, bloating, pain, irritation. I personally, I don't even enjoy them, which maybe sounds strange, but I've never really enjoyed vegetables, and so I don't really consume them. So I'm happily not consume it. If you really like them, you just have to assess, which one am I tolerating well? And if we look at, if we consider nutrition for what it should be, it's something that nourishes our body and doesn't harm us. It doesn't cause us pain. And if we look at through that lens, because if you like, every time I go to this restaurant or have this particular dish, I feel awful afterwards, well, that's a signal that maybe you shouldn't be eating that. We sort of accept gut discomfort, bloating, gas, pain, belching. It's not. It really isn't. You wouldn't accept that in any other system in your body. When your knees hurt, we know something's wrong. When
Yeah.
we have difficulty breathing, we know something's wrong. When our chest hurts, God forbid, we know something's wrong. So when our guts hurt, there's something wrong. It's either your gut is broken in a way, it's disease, or the food you're consuming most likely is the problem. And a lot of times, what breaks the gut is consuming, chronically the wrong foods anyway.
Yes, absolutely. In fact, this has been a personal case because my own family, my own husband had this issue of rectum bleeding for quite a long period of time. And I remember taking him to the doctor, and we used to consume tons and tons of salads and fruits and vegetables. And he kept having this kind of bleeding. And I remember when I took him to the doctor said, "Oh, you need to stop off all his red meat, no chicken, no mutton, no lamb, nothing." And that's when I was just transitioning into the carnivore, kind of researching and learning more through your research papers and your books and other YouTube videos. And I said, I am going to do something different and see how this is going to work. And touch wood, it's been about 3 years now. He's had no such signs, no such symptoms, absolutely no bleeding. He is just a carnivore. He eats just 2 meals a day, pure meat. And it's all just sorted off. So this is one of the things, like what you said, you have to do it for yourself objectively to see what happens to your own gut and how your gut is handling it.
Yeah, the whole concept of, meat is going to cause damage, particularly in our colon. If we look at and we've got really good data on this, meat is completely absorbed in our small intestine. It doesn't even get into our colon. And so to sort of blame problems of the colon on meat is kind of silly. I mean, if you talk to anybody that's had what's called an ileostomy, where the colon has been removed, and you see what's coming out of that, it's all vegetation. It's vegetables, it's grains. It's never meat. Meat is completely digested in the small intestine, so it has very little impact on the large intestine. So if you have colitis or ulcerative colitis or things like that, where you're bleeding from your rectum, so to speak, it is most likely not coming from meat. It makes no physiologic sense. If anybody understands basic gut anatomy and physiology, it's pretty clear. Now, why do we associate? Again, we have this associational data. We have, and much of that data has probably come from U.S. populations. It's just been, it's sent over to India to use. And again, we have people that, when we eat meat in this country, it's usually in the context of a hamburger patty with French fries and a crappy sugary drink and a hamburger bun, and that confounding is what's likely leading to this problem. It's not pure meat, like you said. Interestingly, like if you go to the data on meat consumption in parts of Asia, particularly East Asia, Japan, China, Korea, things like that, they looked at meat consumption in the context of things like cancer and found no relationship whatsoever. The only reason that relationship holds up is in the Western countries, where we consume meat in the context of basically junk food. And, and we have this so-called healthy user bias. We've been told for 50 years, red meat is bad for you. So if you continue to eat red meat, you're more likely to smoke and less likely to exercise and more likely to drink alcohol, and on and on and on. And that confounding bias is probably enough. Now, if you have someone like me who doesn't drink, doesn't smoke, exercise, eats meat, you're most likely going to be quite healthy.
Yeah. What about organ meat? I have never seen you eating organ meat. Why?
Well, I don't enjoy it, so I'm not going to eat a diet I don't enjoy. I mean, this is, it's like, well, if I've got to eat something that I find not enjoyable, I'm not going to do that diet. Organ meats are obviously they can have concentrated sources of nutrients, vitamins and minerals and things like that. And that's certainly true. What I have seen, and again, I'm one of the guys that has been around for a long time doing this diet, and I interact with people every single day of my life that do a carnivore diet, and I've collected data on these people. I've got data on 12,000 people doing this diet. Ask them, do they consume organ meats or not? And there's no difference in the outcomes, really. I mean, they're not better, they're not healthier, they don't reverse disease at any greater rates. The Harvard University study, which you mentioned earlier in this talk, they found the exact same thing. Organ meats are not necessary to be successful on a carnivore diet. Now, can you consume them? Sure. If you enjoy them, and a lot of cultures, they use them as sort of particular dishes. There's nothing wrong with them in a way. I mean, there's some people that suggest that maybe you could overconsume them, but I think eaten in moderation, they're fine. But are they necessary? I would disagree with that. I don't think so. And that's just based on the observation of many thousands that do fine without them.
Absolutely, because even I, at times, I do enjoy organ meat, but then there are times that I will not probably take them for months together, and there's nothing that I have really missed, or I feel that I have missed out if not taken organ meat. What
Yeah, I
about?
mean, well, go
Go
ahead.
ahead.
Sorry.
No,
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 I
go
was
ahead.
just going to say the people that have been doing this, like I said, I'm coming into my 8th year. There's people who have been doing this for now many decades. And when you talk to those people, they all are the same of opinion. It says the organ meats are not necessary, and most of them don't consume it. And so, maybe early on when you're particularly malnourished and you're coming from a state where you've been eating a poor, low quality diet for many decades, sometimes the organ meats can help to bring you to sort of a normal level of nutrition. And then after that, you find that you don't desire them, you don't crave them, and so perhaps it's one, if you have a particular craving for, say, lamb's liver or something like that, then maybe you should eat that. But then if you no longer desire it, then it's probably not needed.
It's not needed. Yeah. This is one of the reasons I love the carnivore diet, because it's so flexible. I mean, it's your choice. Nobody forces you to eat anything. And plus, the satiety levels are so high that there's nothing that you can overeat.
Yeah, I mean, it's hard to overeat. I won't say it's impossible because, but I mean, I think for most people, they find that when they eat, and I don't know what a typical serving of meat in India is, but if you sat down to consume, say, half a kilo of meat, I think many people would be like, "Oh, I can't eat anymore. I'm full." That's and
That's
that's
me.
and
Yeah, true.
that for me. I routinely will can sit down to a meal of 1 kilo of meat, and I know that sounds kind of bizarre, but I mean that's, and like I said, I'm a big person. It's very easy for me to do that, and I don't gain weight even consuming that much. And sometimes I'll do that twice a day, and I've done so for many years, and I maintain my body weight very easily.
What about nose to tail context in terms of carnivore diet or a lion diet? What is
Well,
your
I mean, that's certainly, again, that's basically just including the organ meats, and maybe using like things like bone marrow, which is quite flavorful actually.
yeah?
There's nothing wrong with
It's
that.
fine.
Again,
Would you say it's beneficial? Bone marrow and broth.
yeah, it can be. It is. I think one thing that I guess in general for people, if you're with regard to broth, if you are transitioning to a low carbohydrate in general, we know that our insulin levels will come down, and that's probably one of the benefits, arguably. And when those insulin levels come down, what it does is it tells our kidneys to stop holding on to so much sodium and so much water. And so we see a reduction. We end up sort of have this so-called diuresis, where we lose all this excess water. Now, sometimes you have to replace some of that. So the bone broth can be a good way to get your minerals, and those minerals are what keeps us hydrated. If you just drink pure distilled water, your body will immediately just get rid of it. It needs those minerals to keep that water in our body, because we want to have a certain concentration, so-called or sort of osmolality in our blood and our tissues. So yeah, they can be beneficial. There's nothing wrong with them. Marrow can be a wonderful accompaniment to a meat. A lot of people make marrow butters and things like that, which are quite delicious. So that's something that is a very tasty, quote unquote, type of organ meat. Marrow is. It's quite delicious, actually.
Yeah. What is your take on fats, as in cooking in fats? Because again, India has this fear of cooking in ghee, cooking in coconut oil, and now that we're seeing a very slight rise with a very few people cooking in tallow, for myself included. So I started cooking meats in tallow. What is your take on this?
Yeah, traditionally, prior to about, I don't know, the early 1900s, the majority cooking fats in the world were animal fats. And I know India has a rich culture of cooking in ghee, which is a wonderful, wonderful fat to cook. And it's got a high smoke point, it tolerates high heat cooking very well. Uh, you know, the tallow is also great. It's got a good flavor. Animal fats generally taste better, I think. Duck fat, goose fat, tallow, lamb's tallow, lard in some cases, are all high quality fats. They don't oxidize very well. They tolerate heat very well. So they're great. They're great. All these new oils that we've introduced, clearly they were not a part of the human diet for most of our existence. So, because we can go back in time and argue about did humans pick berries and eat tubers, and how much meat were they consuming? But we know unequivocally we were not eating canola oil. We were not eating palm oil. Those things those products never existed until modern processing. And the same thing with the ultra processed foods. I mean, these are all foods that we are not anatomically designed to consume. Now we can consume them, and the processing makes it cheaper and it makes it more accessible and provides more calories, but they're presenting to us in a way that our body is not accustomed to. We're not physiologically adapted to that. And in many cases, I think in most cases, it's leading to these diseases of modern civilization. And the expectation that by 40 you're going to be sort of have arthritis and slowing down and not be able to participate in things is a false expectation. That is very common, but it is not normal. It's by no stretch of the imagination. You should be, in your 60s and 70s, still able to run and jump and play. I mean, that is what I think the human experience is supposed to be. You can't imagine that spending half of your life suffering in misery makes any sense at all. It's not how we're designed to be as a species. There's no other species that spends half its life, limping around and miserable.
And they just blame it on age and genetics. So, I'm getting old, so that's fine. This is going to happen while I age, and I don't know how they have accepted this.
Yeah, I mean, and it's, you look around at all your friends and your sort of, your peers are all aging and slowing down. So you expect that to be normal, but it doesn't have to be. You should be able to do many of the things you could do as a young adult or even as a child well into your 5th, 6th, 7th decade. I mean, that is something that, I believe is attainable for many people.
Yeah, true. Shawn, India also has many professional athletes. And what would you say in terms of the carnivore diet or a meat-based diet in terms of maintaining peak performance for them? Because again, this myth here is that carbohydrates are essential, glucose is required for a run or a marathon. And I see so many marathon runners now becoming diabetics.
Yeah, that is unfortunate. We are seeing a lot of, particularly endurance athletes, marathon runners that have high levels of vascular disease. And the question is it the chronic cardiovascular exercises they're doing, or is it maybe the diet that supports that? Because a lot of runners are consuming all these sugary gels and are eating very, very high carbohydrate diets to support that. And so maybe that's not the best strategy. There certainly are many now professional athletes, including endurance athletes, to include power athletes, to include strength athletes that are adopting carnivorous or nearly carnivorous diets and having wonderful success with that. I think when it comes to recovery, and I'll pick on India a little bit. You're the most populous country in the world. You just surpassed China recently. So 1.4 billion people. If you look at Olympic gold medals, you've got very, very small amount, and I think the diet is part of that. You're not consuming enough, and you're just not consuming enough animal products and not enough high quality protein to support high level athletics as a country in general. Now there are exceptions. Obviously, there are people that are going to be they're going to do well. And obviously things like cricket, which is that the national sport, they've had quite good success in that. But I think that absolutely meat should make up a major percentage of an athlete's diet, high quality protein, whether or not you choose to consume carbohydrates or not, are kind of one, dependent upon the sport you're doing, two, dependent upon your personal preference. If you are going to do a so-called carnivore diet as an athlete, you can expect it to take, maybe 6 months to make a full transition before you start to really feel it. But I've seen everyone from American professional football players to, combat athletes to ultra marathon runners to triathletes to, we just had a rock climbing guy, break a world record as a carnivore. We've got guys on the U.S. wrestling team. I mean, many athletes now that are finding a carnivore. The Norwegian soccer player Holland, basically a carnivore diet, one of the most prolific goal scorers, in recent times. And so, yes, it is becoming more and more popular among many athletes.
Fantastic to hear. And thank you for that note. I want to know your views on fiber. Now, this is another myth we are fighting here. Fiber. No fiber causes constipation. Meat causes constipation?
Yeah, meat, well, I can tell you that I have normal bowel movements. I go to the bathroom pretty much every day. Fiber, in my view, is, and I just saw a wonderful presentation by a gut microbiome researcher basically saying we think we may have overplayed our hand on fiber. We're finding out that, some of the benefits say, like, we will ferment fiber into these things called short chain fatty acids, which are supposedly going to protect the mucosal layer and things like the colon. They found out that amino acids can do that. We can consume them directly. Long chain fatty acids can do that. Ketones in the context of a low carb diet can all do that. So the fiber sort of has been a little bit overhyped in many ways. I think it is conditionally beneficial, and most of the benefits of fiber are in the context of this high sort of junk food type diet. So if you're eating more fiber, you're probably eating less sugar. Basically, I mean, that's kind of what you're seeing.
Yes.
But if you don't consume sugar in the first place, the fiber is not going to provide any additional benefit. And honestly, in some cases, fibers can make things worse. Now, if you look at constipation specifically, there was a great study that came out, I don't know, about 8 years ago, looking at, there's a guy, Paul Mason, has done a nice presentation on this, and he shows the results of the study quite well. But, a zero fiber diet was actually curative of chronic constipation. And, some people look at this problem. If constipation is like a traffic jam, adding more cars to that traffic jam is not going to help. And so what you want to do is fix the neuromuscular problems that are going on. And fiber is not the solution to that. It's usually eliminating inflammatory things. But meat has been very beneficial for gut health, in my view, and in my experience, because I've seen people with chronic inflammatory bowel disease, or irritable bowel syndrome, rather, inflammatory bowel disease, reflux, all those things get better on a meat-based diet. And so the fiber, in many cases, has been counterproductive, and it's been overprescribed. I think it is, again, its benefit is largely to move otherwise junk out of the diet. And beyond that, I don't think it has that much benefit.
Yes, absolutely. Thank you so much. Thank you, Shawn. Such amazing insights from you, and for me to learn as well. Well, as much as I would love to continue our conversation, I guess we'll have to save a little for the next time. Thank you so much, Shawn, for being on our show, and thank you for your presence. It is an honor to share screen with you, and I'm hoping to have many more conversations up again with you. Thank you.
Well, I'd love to do that. Thanks, Mahek. Thanks, and Shashi, thanks for having me. You guys have a wonderful rest of your conference, and have a good evening. Okay.
Thank you, sir. God bless you.